I am reading off a script, so it's going to sound like I'm reading off a script. This is the one of the ways that I accommodate myself as an autistic person. So I'm Ollie. I'm an AuDHD and chronically ill therapist at Balance and Birch. I specialize in working with neurodivergent people, chronically ill people, people with anxiety and depression, people experiencing grief, and people experiencing major life transitions. This is my coworker, Iesha. And I will let her introduce herself before I give some background on today's podcast topics and then ask Iesha some questions.
All right, everyone. My name is Iesha. I am a mom of three. I have three boys. First boy is 8. My second child is almost 5, and I have one on the way. Outside of me being a mom, I work as a yoga and mindfulness instructor at Balance and Birch, where I am a trained and certified yoga instructor where I teach neurodivergent individuals, trauma survivors, and those who experience secondary trauma. So essentially, I teach my clients different self-care techniques on ways to cope with anxiety, depression, sensory sensitivities, as well as lack of body autonomy. And I offer them those different types of tools so that they can cope with them, well, with those symptoms.
Awesome. Yeah. I really love the work you do. And I think it's really incredible the lens you work through with like knowing how to work with neurodivergent people and especially with trauma because so many people just in general have trauma. So I think it's really great that you come from that lens.
Thank you. I
Thank you.
appreciate that. There's definitely it ties in together, trauma and neurodiversity for sure. So, but I'm excited to get into that.
Yeah. So, with April being Autism Awareness or Autism Acceptance Month, I wanted to talk to you, Iesha, because your son is autistic. And I think that you have a very unique perspective on autism. So, within parts of the autism community, especially among autistic adults, um, there's a lot of tension around this idea of autism moms. So, to the best of my knowledge, an autism mom is a non-autistic mom of an autistic child. The tension that exists there is not the case for everybody, but it's definitely a topic of discussion, especially among like I guess, like what would be classified as level one autistic adults who tend to be more hyperverbal, and especially among those of us who are late diagnosed. So from what I've seen and heard, a lot of the tension is around adult autists feeling like autism moms are making the wrong decisions for their children or are speaking over autistic voices. Also, the reason I'm putting autism moms in quotes is because very often in the autism community, it's used as like a bad phrase, like or almost like a bad word. And so I'm trying to differentiate between what I'm describing the autism community as defining as like autism moms and them identifying that as being a bad thing versus what it really actually means to be
Okay.
an autistic parent um, or a parent of an autistic child. I apologize. So, one of the hotter topics of discussion related to autism moms and some of the tension around that is ABA therapy, so applied behavior analysis, because historically, ABA has been seen as bypassing the needs of autistic children and forcing them to be normal or neurotypical, which a subset of autistic adults who have been through ABA have said has caused them a lot of trauma and actually PTSD. I don't want to invalidate that there are definitely like that has happened, and also that there are definitely parents of autistic and disabled children out there that don't seem to truly tune into their child's needs and that really want to force the child to be normal at the expense of the well-being of the child. And I don't think that the accusations and fighting that are taking place between autists and autistic moms, or autism moms, sorry, and within the autism community is really helping the progression of increasing awareness and acceptance of autism. It's also not really helping anybody get their needs met.
Mhm.
So I want to really quick note, make a note about my use of the word disability to describe autism. Under the ADA, autism is classified as a disability, and I personally choose to identify as disabled due to my autism because I feel like avoiding the word disabled can add to the stigma around being disabled. I also personally feel disabled by my autism. However, not everyone in the community, this includes autistic individuals and parents of autistic individuals, chooses to use the word disability to label autism. Some people might use phrases like differently abled, or identify autism as a disorder rather than a disability. It's important for me to advocate for autists to choose the labels that they use, and not pass judgment on them or pass judgment on parents who use different labels, while acknowledging that completely avoiding the use of the word disabled in one's vocabulary, like literally never using it, is definitely rooted in ableism. So autism comes with a complex history. So it's going to come with a lot of complex experiences for autists and their loved ones. So going back to ABA, I recently heard a lot of autistic individuals and parents of autistic children share that ABA has drastically changed and focuses a lot more on accommodating autistic children and people while giving them tools to navigate the neurotypical world. So I'm not an expert in ABA, so I can't speak to this. So, being that I'm an autistic person who experiences the world through the lens of autism, I want to invite you, Iesha, to share about your experiences as a mother of an autistic child, because you have that very unique experience and perspective of with autism. So I think that your voice and your input are truly invaluable, and that people like you and I have to have open conversations about these subjects, even if there's disagreements. So not that you and I personally are going to disagree, but just if disagreements arise in general. So so autists ourselves and autists and autism parents have such different experiences with and perspectives on autism. I personally think it's wrong for autistic individuals to blanket exclude the voices and concerns
Mhm.
of parents of autistic children. Though, of course, there are some parents who genuinely have it wrong and do need to change their approach to parenting. Um, but like just a side note there, with autism being as complex as it is, sometimes you genuinely think you're doing the right thing for your child. Hell,
Yeah.
I mean, parents think they're doing the right thing for their children most of the time, and
Mhm.
only find out later once the child's an adult, like, oh, that is not the right thing to do.
Fucked up.
And
Yeah.
I think that just speaks to the fact that being a parent's complicated. I'm
Yeah.
not a parent, but looking at my own parents who were far from gold star parents, they were the opposite. But talking to them today, they really truly thought they were doing the best thing for me. But as they've gotten to know me more as an individual and as an adult, they've even said, like, we didn't know that you
Mhm.
needed those things. We genuinely thought we were doing what was best for you by pushing you in this way, or being a helicopter parent in this way. Like, and again, like the challenge of parenting isn't just with neurodivergent children, just with disabled children or anything like that. I think being a parent is hard. And I don't think enough people give parents a little bit of wiggle room on like, it sounds like a lot of it is guesswork,
Mhm.
because like there's no perfect manual for, okay, you have this type of child. This is exactly how you need to parent them. I digress. I'm being on a tangent here.
No, it's
Um,
okay. It's fine. I'm
so
following for sure.
Um, but yeah, so I think that really, like I said, it's important for us to have these conversations. And as long as the only thing happening in the autism community is people arguing and disagreeing with each other, we're never going to learn and grow. So,
Mhm.
for example, if there are parents doing things that they don't realize are harmful, if you just have autistic adults yelling at you and telling you that you're wrong, you're going to shut down and not listen.
Yeah.
Having open conversations allows both people to learn and grow and open their minds to different perspectives.
Mhm.
So, in the spirit of curiosity and learning, I have questions.
Okay.
So, first question. Do you consider yourself an autism mom, or autism mom without quotes? And if you do, how would you define it?
Um, yes. So first of all, thank you for opening up this platform because you just gave me a lot just now. But I want to revisit all of the some of the points that you mentioned before. But I'll answer your question, of course. I do consider myself as an autism mom. In fact, I wear the title as a badge of honor. Honestly, because my son Phoenix is the one who's autistic. He's my second child, and he's taught me a lot he's been here. So being an autism mom means I get to be his first advocate, right? So be the first person in line to speak up for him and his needs. It also means that I get to accommodate him, right? So when I say accommodate, I mean really learn the type of person he is, learning his patterns, really paying attention to it and seeing what he needs in different moments. And for instance, that can be while we're out in public, like a grocery store or something where there's a lot of people and it's noisy. I can offer him, noise canceling headphones, and he finds safety in that. Or even when, just like first started therapy, I had to spend time away from him and he didn't like that. So that was us giving him or having the opportunity to give him his security blanket. He has a blanket where it's very soft and he feels really safe with it. Um, so just offering those different types of accommodations just so that he can feel comfortable, especially as a young child, just trying to learn to navigate throughout the world. And just being okay with that. His older brother is considered quote unquote neurotypical. So we never had to apply those certain accommodations. And actually, we weren't as knowledgeable of those certain type of accommodations with his older brother. So we really had to learn that too. It was a trial and error, and that goes back to the point that you made as far as parents. We're just almost winging it, really. Each child is different. So you kind of gotta adjust to each one of their personalities, whether they're neurodivergent or quote unquote neurotypical or you just gotta do the best you can and show up in ways that your child will need you in the moment. Later on down the line, once they become adults, they may bring up certain things that you weren't aware of that like you said, your parents thought that they were doing okay. They thought that they were doing the best that they could, but I think that's what it takes. It's really just showing up, doing the best that you can for your child. Being an autism mom also means that I get to learn different ways of communicating. So when my son was young, he actually was speech delayed. And I had to, like I said, figure out patterns and ways in which he would communicate to us, whether that was, grabbing our hands and leading us to what he needed, or just creating different schedules so that our schedules were very consistent, um, so that he'll know when, what time is it time for us to brush our teeth? What time is it time for us to put our shoes on and go bye-bye, right? So I think with creating those certain schedules, I'm forgetting the words, so excuse me, I'm forgetting the word is popping up in my head, but
Routine,
what'd you say?
routines.
Routines, all of that. So
Yeah.
creating routines so that you know our daily routines are predictable for him. Um, but then it also made it easier for us to kind of communicate back and forth, what he needed. Um, and I think lastly, I think I think now we've found like our momentum, kind of like our sweet spot. He's almost 5. So now he's verbal now. He knows our routines. And I think a lot of that had to do with all of the therapies that he participated in earlier in life. Um, but I think that those will be the top points as far as being what an autistic mom is.
Yeah, thank you for sharing all of that. And I mean, I just want to say too, you mentioned the phrase trial and error. Something that I'm really glad you used that phrase to specifically describe parenting autistic children, because I use that phrase as an autistic therapist who works with autistic people to prep my autistic clients for what therapy is going to be like. We know so little about autism because there's been this big change in the field where we realize, oh my gosh, we have completely misconceptualized this disorder, this disability. And there's so many different presentations of it and so many different factors that contribute to how autism expresses in a person. I tell them like, look, I've got knowledge about autism and I use a specific therapy to help autistic people, and here are my reasons why I think it's helpful. And it's going to be trial and error.
Hmm.
I mean, that's just the reality of it. And I think it's interesting that people pass judgment on autism moms or autism parents for doing trial and error things or just giving it their best educated guess when professionals are doing that. Um, and I mean, I think it's important, like, I think an important aspect of that is choice.
Hmm.
And is like, does the child have some level of choice, but also we could go on a whole tangent of like how much choice should a child have because
Yeah.
then it can create a way lack of structure and just anyway. But just wanted to say like I really like that you use that phrase, and it's like one of the first things I tell clients that I work with, like, this is not, I'm not magically curing you or helping you fix things perfectly. This is trial and error. We're doing this together.
Hmm.
Some things are going to work, some things aren't.
Hmm. Exactly.
Yeah,
Yep.
I absolutely understand that. Thank you for sharing all of that. I think that's really enlightening, and I think it sounds to me like a part of wearing that title as a badge of honor is growth. Like in
Yeah.
your, like, seeing, loving your son in the way that he needs for you has given you the opportunity to expand your knowledge of the world and learn how to love someone in new ways, which
Mhm.
is exciting. I'm sure
It is.
it's not only exciting. I'm sure it can be tiring to constantly have to adapt and all of that.
Yeah.
But yeah, I think that's really admirable.
Oh,
Um,
thanks.
yeah. So another question I have. You've mentioned in the past that your son is in a variety of therapies and support programs. I wanted to learn more about what those are, of course, to the degree that you're comfortable sharing, and what led you to choose them for him.
All right, so I do want to mention, I guess just going back to birth, really. Phoenix was diagnosed with a rare heart condition called tricuspid atresia. And what that is actually in utero was when he was diagnosed. So I was pregnant with him when he was diagnosed. Doctors noticed that his tricuspid valve in his heart did not form at all. This particular valve is responsible for pumping blood from the right side of the heart into the lungs, which makes it really hard for baby to breathe and for his oxygenated or the oxygen to flow throughout his body. So sometimes you'll see children with atresia with their lips blue or their toes might be blue, and this might be because blood is not flowing throughout their body the way they should. So with that being said, he stayed after I delivered him. He had to stay in the NICU for about a week or so. And during the time he was in the NICU, he had a procedure done where they had to place a balloon in his heart in order to allow the blood flow in his heart to be as effective as it could be, so that he can get oxygen throughout his body. So on top of him not coming home as soon as possible, he had to go through a series of different heart surgeries in order to correct this defect. So between the ages 1.5 and I believe 3.5 or so, he underwent two different heart surgeries, along with him going, having the hospital stays and things like that. He had a long time of recovery on top of the 14 different medicines that he was sent home with. So he was already delayed developmentally because, of course, he couldn't do some of the things that you would go home and do with your baby. We couldn't pick him up underneath his arms. We had to kind of like scoop him up because we didn't want to mess up anything in his chest. Um, Also, we had to, he couldn't do tummy time. So he couldn't lay on his belly. He had to always lay on his back. We had to monitor that. There were times where he was sent home with the heart monitor. We had to, monitor his oxygen levels and the blood flow in his heart. And it was a time where he had to go through all of that before we even found out he was autistic. So, with him being developmentally delayed because of his hospital stays, we noticed that he just needed help with learning basic skills, right? So we put him in occupational therapy. That was the first therapy that we put him in, just so he can learn how to play with others, or just regular skills, pull up his socks or learn different toys and things like that. So he would spend time in occupational therapy, just learning the basic skills and the knowledge that a 2 year old or a 1 year old would need. After we put him in occupational therapy, we noticed that his speech was delayed. So mind you, this was all during COVID. He was born April 2020. The world shut down March 2020. So this was all during COVID when the whole world either shut down or was delayed, right? So um, we were on the wait list for him to start speech therapy for some time. But when he was able to go ahead and get into speech therapy, um, we learned different ways and techniques to kind of incorporate different speech into his lifestyle so that he can start to pick it up and start to retain the information, whether it was different sign language or just different questions to ask to kind of prompt him to use his own language. um so that was the speech, and then let's see, after speech he oh I think that's kind of when the food regression kind of happened. Just before he turned two, it was about 1.5. He was 1.5 um, when he started to regress. And of course, 6 months is when we introduced table food to him. So it was a point where he just stopped eating food altogether. He woke up one day, we gave him Honey Nut Cheerios, and all of a sudden he didn't want to eat anything but Honey Nut Cheerios. But it was very interesting because once we started introducing food to him, he was so open, to carrots, chicken, a lot of different things. So it was very strange for us when we found that he just didn't want to eat at all. So we set up appointments with a gastroenterologist, a nutritionist, and eventually he was diagnosed with something called oral dysphagia. And oral dysphagia is the diagnosis where with a person has sensitivity as far as textures in the mouth. So he didn't appreciate some of the food textures that we were giving him, in which I completely understand. I think we all can kind of relate to a certain food that we just don't like because we don't like how, the texture is. But for him, it was an actual diagnosis. So we kind of knew at that point we had to step back and kind of just offer him a little bit of grace, because now we understand, like, he doesn't like some of the textures that we like. So we got to figure out which foods he's really going to eat. And that was another trial and error thing. So he started feeding therapy. So he was in occupational therapy. He also speech therapy and feeding therapy, all while we're on the wait list of starting ABA therapy, because soon, or right before he was diagnosed with oral dysphagia, he was diagnosed with autism. So this was a lot. And let me know if you need me to stop, because it's a lot to follow. But we were on the wait list for him to start ABA, and they ended up, calling us. It was a few months that we were on the wait list, but they ended up calling us, letting us know that they were ready for him. After researching the center, the ABA center, and speaking with the lead tech there, the lead tech mentioned to me that everything that we're working on with him, they can do at ABA therapy, because it was recommended by his doctor that he spend at least 20 hours at ABA per week. So we came up with a schedule that he would attend ABA 5 days a week, 5 hours out the day, all while taking advantage of the ABA services, but they were still working with him occupational feeding, and speech, as well as potty training too. So they did a lot with him, and which is why I can understand why people say, ABA has changed so much because with Phoenix's case, he's been thriving in ABA. Um, but of course we can get into that, but that's exactly the whole reason why he started all of these therapies was number one, because he was previously diagnosed with a congenital heart defect that kind of displayed that let us know that he was delayed. And then it kind of just moved from there. It was like a big, like everything just started opening up from there. We started paying attention a little bit more. Um, and I do want to say, sorry, I can be a little bit long-winded, but I do want to say that he started stimming, which was very unfamiliar to us. And he would do this thing where he'll wiggle his fingers and his toes, stiffen up his legs and his arms, and he would like stiffen up his body. When we would see that, we would think that he was having seizures, but his eyes were open and everything. So he had to stay in the hospital and get tested for that for a few days. And then we learned that, it wasn't seizures. So I think that kind of put me down the rabbit hole. Okay, so what is it, right? So what can it be? So, we started doing research and things like that. And I brought it up to his doctor for him to be evaluated for autism. And he was evaluated and diagnosed. And then we were able to kind of just go from there. We knew where to start. So yeah, does that answer your question?
Yeah, yeah, it does. I think two of those therapies I'd like to learn more about. So feeding therapy and ABA. So for him specifically, what does that look like? And again, please feel free to share as much or as little as you'd like, because I know I'm asking about your child's medical history.
Mhm.
Um, so if you don't want to answer questions about him specifically, you can share more about just maybe some general things you've learned about feeding therapy and ABA.
Okay, yeah, no problem. So feeding therapy, it looked like a feeding specialist or a nutritionist sitting with Phoenix at a table. And it would be them two while I would sit kind of like in the background out of his sight so he wouldn't get distracted. And they'll have let's say three different foods. One of his safe foods or two of his safe foods and one food that we would like to incorporate into his diet. So this would be Cheerios, a bottle of milk, and then some green beans, right? Because he hated green beans. So it'll be those foods while the therapist is sitting with him and trying to get him to choose whichever food he wanted to try. But on top of her trying to get him to choose, she would incorporate different toys. So she'll line up like different farm animals because at the time he would like to play with the farm animals. So she would line up the different farm animals and say, hey, which food do you want to feed the elephant? Which food do you want to feed the pig? Or which food do you want to feed? Or whatever, right? So she'll give him choices to feed, which food she wanted to feed the animals. And then she'll kind of incorporate Phoenix. So she'll say, well, which food does Phoenix want to eat? Right. So that worked after a while. Of course, he was very apprehensive and hesitant. But it worked after a while. He was willing to try it, but of course we had to take breaks because sometimes he'll get frustrated or even burnt out at the table, like he didn't want to participate at all. He's like, let's go do something else. Um, so that was also a trial and error thing for the therapist because she had to figure out an approach. There were a couple times where he just didn't want to participate at all. And then she found, incorporating the toys that he liked would probably get him to be more willing to eat his foods. She also would incorporate the senses, right? So for an example, she would use like oh goodness. She would use like a sheet, and the sheet would have different pictures on it. My brain is clouding up now, but it will have different pictures on it, and it will have the different steps to take. So the first step would be first looking at the food, right? The second step would be touching the food. The third step would be smelling the food. So picking up the food and smelling the food. And then the next step will be kissing the food. And then the next step after that will be licking and then and biting the food and then swallowing the food. So it took different steps for him to actually see which step was next for him to get comfortable with those different strategies that his therapist was introducing to him. So that was feeding therapy. As far as ABA therapy, ABA is applied behavioral analysis. Um, and for me, as a mom observing outside of the spectrum, it meant assisting and teaching the child how to cope with like everyday stressors and how to just manage their behaviors without them becoming too problematic. Um, so I think it's important to kind of emphasize too here that the ABA center that Phoenix was or is still going where he's attending, they not only do that, but they also allow Phoenix to be himself. So they see where he draws the line and they kind of meet him where he is. And a lot of that had to do with a bunch of advocacy from me too, letting them know how he responds at home and what he's used to so that they can apply it there at the center. Um, and I can understand why people would say, how I guess changing up these behaviors at ABA will cause some type of PTSD or trauma, because the change seems very abrupt and it also seems very unsolicited for the child, right? Because you're changing their habits. But I think that while he was in ABA, they were, like I said, able to kind of meet him where he was and just show him variations of coping mechanisms on how to deal with his environment. Um, yeah, I'm gonna stop there.
No, thank you for sharing all of that. It's interesting for the feeding therapy. That is how they treat ARFID. I'm forgetting what the A in ARFID stands for. It's something restrictive food intake disorder, which probably comes from oral dysphagia,
Mhm,
frankly, because it's just an extreme sensory aversion to certain foods to where it happens, I think, most frequently in autism.
mhm,
Where autistic people, like children, will deprive themselves of nutrients unintentionally because of the sensory aversions. And so I was curious about the approach to feeding therapy because some people will do exposure therapy, which actually is typically what leads to trauma, like the intense exposure therapy.
mhm,
Like, no, you're going to eat this and you're going to deal with it. And I think that's how a lot of people view ABA, because I think that is how ABA was when it first started out and how
mhm,
feeding therapy was when it first started out. But I think as people have learned, like, the rigidity that autistic people experience, it's not as rigid as a lot of people think.
mhm,
It's giving autistic people the opportunity to try new things on their terms, which
mhm,
is what I'm hearing you're saying is what feeding therapy is.
mhm,
It's exposing him to different aspects of the food, incorporating his potentially even like a special interest to
mhm,
make it a really positive experience and giving him some level of like a pretty big degree of choice.
mhm,
Um, and what I've noticed for teens and adults who are autistic with ARFID, who are trying to incorporate new foods, it's almost identical. They have like the food that they're not as thrilled about or that they're averse to, um, next to a food they prefer.
mhm.
So, like, it gives them the autonomy to choose if they want to try it. And then if they try it and they don't like it, they have their safe food next to them.
Yes.
Um, so I like that you gave that description because to me that is as much as I want to say autistic people need to be accommodated 100% of the time. In an ideal world, we would be. We don't live in that world.
Hmm.
Children need nutrition.
Hmm.
So unless they're going to end up with a G tube or something, they have to be able to get their nutrients. And a G tube is far more dangerous
Yeah.
than trying to do graduated exposure through the use of autonomy and special interest and things like that.
Hmm.
And it's interesting because the way you described ABA is essentially the therapy I do with my clients.
Hmm.
And again, I think the big difference is they're adults, and so I can give them a really long spiel and they can make a choice about that.
Yeah.
But again, comes down to like the parent is the advocate for the child. A child can only make but so many choices. But point being, with my autistic adults, I have the conversation with them. If you expect to live in neurotypical society, realistically, you are probably never going to be able to unmask 100% of the time.
Hmm.
That being said, let's figure out how to teach you how to mask and unmask, teach you what your autistic needs are, and you choose, given your knowledge of certain situations or people or your feelings of safety internally, when you're going to mask versus not. And then once you mask, you go home and you stim and you do all of this to let it all out.
Hmm.
Um, in From what I've gleaned from what you've shared and from what other adults who have been through ABA recently have shared, that's kind of what ABA is turned into.
Hmm.
Trying to say, like, hey, look, like, here are the necessary skills to be able to interact in a neurotypical society.
Hmm.
And for some people, it could be deadly for them to not have those skills.
Yeah.
Um, I I'm white, so I am very privileged.
Hmm.
And as I've learned more about autism,
Hmm.
I have learned that the experience of autism for white people versus anyone who is black or a person of color
Hmm.
is very different.
Hmm.
It became glaringly obvious to me, it was too late, like way too late in life that I realized this. But I follow, I believe the mother is autistic, but her son is too. I think her handle is fidgets and fries on social media. And I think either she was sharing this or she was sharing it about someone. There was a black father talking about how ABA saved his son's life
Hmm.
because if his son had not been through ABA and learned neurotypical socialization skills
Hmm.
when he encountered a police officer, if he had behaved autistically, he would have been killed.
Hmm.
So when I have clients that come down hard on ABA, I try to say, like, express to them, just because you don't like it for you doesn't mean there aren't people who it can be life changing and life saving for. And I think most parents would prefer their child alive
Hmm.
and a little bit uncomfortable, distressed, or even a little traumatized and
Hmm.
work through that later
Hmm.
than dead,
Exactly.
because they're being their autistic selves. I'll stop there on my explanation of that. I didn't know, though, and again, share as much as you're comfortable with, if any of that plays into your desire to make sure that Phoenix has those skills, being that he's a young black boy.
Hmm.
And yeah, I'll pause there. I just want to know, like, your thoughts on that.
Yeah, most definitely. After seeing, I think, his transformation or the beginning of his transformation at ABA, I became a lot more open to it. So, they would give suggestions on, based off what they've seen or how he responds to certain things. So I became a lot more open to it. It was almost like a teamwork thing where me as his mother, like I said, had to advocate for Phoenix, letting his therapist at ABA know that, this is how he responds at home. This is what I think that you all should incorporate. And then vice versa. They would let me know, hey, this is how he responds here at ABA. Let's find a meeting ground. So with that being said, I learned to trust them a lot more. Um, and after, like I said, witnessing his transformation, it's like, oh, this ABA is life changing. It's life changing because there's no more meltdowns. He's using his words as opposed to showing anger. And those are just basic life skills that are very important for a Black boy to have it in general. So a person in general, right? Not just a Black boy, but a person in general. And with him being autistic, I thought it was going to be much harder to kind of teach him those skills. Um, it was a challenge, but it could have been worse. So yes, I do think that ABA played a big part in that for sure.
Yeah, yeah. That makes a lot of sense. Um, it's interesting. I'll have clients who talk about hating ABA, but sessions later they talk about like this dilemma they feel internally of like, I'm kind of almost grateful my parents didn't know I was autistic and didn't accommodate me at a young age because I don't know how I would function had they not forced me to do certain things.
Mm-hmm.
Like, I'm not saying I love that I have PTSD from my parents. I don't. I'm not grateful for the what I experienced in that regard. What I will say is, had my parents not taught me certain life skills, I would not be capable of functioning in the way I am currently. That being said, because they didn't learn what my unique needs were and accommodate them, it caused me to get screwed up in other ways. But again, that doesn't sound like what you're describing. It sounds like they're trying to find ways to help him regulate his emotions without it leading to destruction, which autistic rage is real.
Mm-hmm.
Um, our nervous systems go from 0 to 1 million just in an instant. And a lot of people don't, first of all, that's not safe for your body over time to
Mm-hmm.
have cortisol spikes that
Mm-hmm.
that take place that quickly. And second of all, it can be dangerous to the individual or again, dangerous to other people. I've heard so many stories of like teenage boys ending up in jail, like autistic boys in jail because they're being autistic for them causes them to have a hard time regulating their nervous systems,
Oh,
and it expresses in rage or anger, and it's heartbreaking to watch it happen because I'm like, does this really need to be and like going to that's the issue isn't it's not a behavioral thing, it's a
mhm.
they an emotion regulation thing. Like I don't think they're trying to harm anyone. I think it's their nervous system's exploding. uh
Yeah. Yeah.
yeah.
And sorry to cut you off, but it's it's almost like they're really, really sensitive when it comes to those certain emotions. So I'll speak for my son Phoenix. He didn't know how to manage that, right? So situations where he found that, he had those elevated emotions and his nervous system was dysregulated, he would fall out. He would fall out and have tantrums. And I hate to make this about me, but I think that's another reason why I do what I do today. I offer my services today because I fell into that rabbit hole and it became so apparent to me that this works for my son. This mindfulness and the yoga works for my son. I know it can work for other neurodivergent individuals as well. So him learning how to just stop and just breathe, different breathing techniques or putting his body in different shapes like yoga. So I think that was one of the reasons why, or I consider it a certain type of advocacy too, where I'm able to learn myself how to regulate the nervous system so that I can pass it on to him. And I didn't feel comfortable trying to teach him how to regulate if I wasn't sure myself. So I had to learn how to do it. I had to learn how to do it, and shit, I'm proud of it. I'm proud of it because I see the difference in him. So yeah, and it's a dangerous thing when you don't know how to regulate your nervous system when it comes to being autistic. And of course, I'm speaking from a mother's perspective because what do you do? What do you do? You may turn to harming yourself at that point. So it's a big thing.
Yeah, yeah, no, I really, really appreciate you sharing all of that. It is. It's for me, you know, I even bristle at the idea of ABA still, just because I've been inundated with so many negative
Yeah,
stories about it. But I think hearing your experience with it in Phoenix is like you watching Phoenix go through it, and also like they're using movement to help him regulate his nervous system and mindfulness, which are two things that are inarguably going to be helpful for someone whose nervous system is dysregulated, regardless of the reason why. Um, and I think meeting a nervous system where it's at is really important.
yeah,
Um, and movement is incredible. I actually always encourage my autistic clients to get involved in some kind of movement-based practice, be it yoga, tai chi, martial arts,
yeah.
dance.
There we go.
Did I cut out?
Yeah, you glitched a little bit, but you're back.
Okay. Oh, it's on my end. Can you hear me okay?
Uh-huh.
Okay. Um, I was just saying that I encourage all of my autistic clients to get involved in some kind of movement, especially structured sequential movements like martial arts, tai chi, dance,
Yeah,
anything like that, like
yeah,
yoga. Um, some people aren't ready for yoga, like slower yoga, because their nervous systems are really going. So I'm like,
yeah,
okay, we'll do something a little bit more fast paced. And then maybe once your body's kind of calmer, yoga is a really good option.
yeah.
Um,
Yeah, I also find too, and that's great advice for sure. I also find too that although we do practice yoga with Phoenix, I think breath work honestly is our go-to for him. Um, because we learned that he'll settle a little bit more, a little bit faster with breath work. But I think it all really depends on the person in general, whether you're moving energetically with the breath or physically with the body. So taking walks, or like you said, some type of martial arts or dancing, just getting that movement in to help regulate is important.
yeah, yeah. Awesome. Thank you so much again. I know I keep thanking you, but it's really eye-opening, I think, hearing. I think, frankly, like I'm shocked how much has changed in the world of how autism is being addressed in children. Because when I was a kid, again, it was the kind of ABA that was like, it was frankly abusive.
Mm,
And I think a lot of autistic adults are remembering that and have trauma from that.
mm,
So, and of course, trauma is going to shut your brain off from learning, which valid. I wouldn't want to learn about it either,
yeah.
if it had caused me trauma. But again, this is why I wanted to talk to you about it, because I think it's really important for people to know it has changed.
Mm,
Um, I've actually even heard other ABA therapists, like just like by talking on like psychology Facebook pages. I've mentioned like, yeah, I've heard some autistic people say they're against it, and ABA therapists will say like, actually, the field's changed a
mhm,
lot, and so this is a really cool, like real life example of I think the ways in which it's changed and how much it can help someone.
mhm.
Yeah, so that's awesome.
Yeah.
Um, Okay, so another question. This is a multi-parter, so if I need to repeat any of it, let me know. Um, so do you feel like you have the support of the autism community and or other parents of autistic children as you work to support Phoenix's autistic needs? And then if he's involved in any like schooling or daycare programs, do you feel supported by them, or have there been like challenges with getting them on board with supporting him?
So when it comes to other autistic parents of when it comes to parents of autistic children, or individuals within the community, no, I do not have support. Um, and so my partner and I, Phoenix's dad, we don't know too many people who have autistic children, and if we do know them, they have not spoken up. They have not, mentioned anything about their children. Um, so I guess the short answer for that would be no. I am in a few Facebook groups, of course, where I can, ask questions here and there or read other people's questions and the responses and things like that. So that's been pretty supportive. In the social media world. But really, our support network comes from our immediate family, who, as far as we know, are not neurodivergent. So my parents, my partner's parents, my sisters and his brothers, and of course Phoenix's older brother, Zen, who he learns a lot from too. So that's kind of like our core, our family. And then we have, of course, his therapist. So his ABA techs. And we also have, because he is a heart patient, he's a part of this clinic at the Children's National in Washington, D.C. It's called the Candid Clinic. It's a developmental clinic that kind of follows the heart patient throughout their childhood. So from birth up until 18 years old. And they kind of just help us with whatever resources we need. They're our go-to people if we have questions, if we're lost. So we have them for support as well. They check in every now and then, and Phoenix sees his Candid Clinic um, specialists on an annual basis. So we have them as well. When it comes to school, he's not in school yet. Excuse me. He will start school in August. So I have been in communication with his school counselors and um, his school support team. I actually tried to get him an IEP, but it turns out he wasn't eligible. So he will be getting a 504 plan, which is like an IEP, but not as intense, I guess. So he'll have a specific plan that's tailored to him and his needs when he goes to school, while of course his parents aren't there, so they know how to approach Phoenix and the things that he need, especially when it comes to feeding and things like that. Um, so I know that we have them because they're in my back pocket. Like their phone number is saved, and if I need to call them, I call them, and they've been very responsive and answering all of my questions and things like that. So I feel pretty confident with him going into school, starting kindergarten in August. So that's another aspect of our support team. Um, but I think as far as, like I said, any other autism moms or uh they're not there. They're not there. But I do want to mention this is another reason why I wanted to bring this awareness to the Southern Maryland area because it's quiet here. It's so quiet where you don't know. You don't know because these people aren't really speaking up about neurodivergence or not even just autism but dyslexia or ADHD. Like people don't talk about that. It's very quiet here, and I kind of want to break down some walls here in Southern Maryland. So that's on the to-do list where I want to bring awareness here in within this community. So hopefully that doesn't, what I said about not having the support, hopefully that doesn't last too much longer, because I want to be able to not only offer the support myself, but also have the support system in other people.
Yeah. And I think it's interesting because I do think to some degree, no, it's not to some degree. I think whether or not autism is being discussed publicly or there are resources available publicly is regional.
Hmm.
Um, I know, where I'm at in Fayetteville, North Carolina, there's like a little bit of discussion of autism on like the local Facebook page. But like out in Durham, North Carolina, about an hour and a half, 2 hours away from me, it's like a hub for autistic people, for like neurodivergent people, for queer people. It's just like it's for whatever reason, there's just so much more discussion of it and resources. And it might be because I live in a more, I don't know, Southern conservative area, and talking about disability can be really taboo
Hmm.
um, within this specific, like the culture of this region.
Hmm.
Um, So I think that's a really interesting point too about bringing awareness to certain areas of the country to break down barriers because autistic people are everywhere. People
Yeah.
with dyslexia, ADHD, um, invisible disabilities or invisible challenges, they're everywhere.
Hmm.
So yeah, we need advocacy everywhere. So I mean, it like saddens me to hear that you don't have that support already. And I think it's incredible that you're saying, look, I don't see anyone talking about it. I want to be someone who brings that awareness.
Mhm.
Because it's needed.
Yeah, like you said, it's everywhere. And now that I'm more aware and have more knowledge about it, because I can physically see it in my own son, I can see it in other people sometimes. And I think that that kind of gives me more of the urge and the fire to say, okay, it has to be done. So I'm excited about the growth and, like I said, introducing it, or just even not even introducing it, but bringing it up in the community.
Yeah.
Yeah.
I think that's the way to start is just start talking about it.
Yeah.
Yeah. Okay, so given what I said at the beginning of the podcast, which was a while ago now, and I said a lot, what would you like autistic people to know about the experience of parenting an autistic child, especially when there's a lot of disagreement on like the right way to parent an autistic child, and given the fact that every autistic person's needs are different?
If my son was 10 years old and I was having a conversation with him, I would tell him I'm doing my best. I promise I'm doing my best. I am learning about the community as I go because originally when he was born, I wasn't aware. I wasn't knowledgeable. So with raising him and nurturing him, um, I I was not forced, but I was more willing to actually learn about the community itself. So I think it's important to offer me as his mom grace, a little bit of compassion and patience, because it can be hard. It can be very challenging. There were, times where it became so stressful where I suffered from anxiety and panic attacks because I didn't know how to handle being an autism mom on top of, me going to therapy and still trying to learn how to cope with my own mental stability. So I think just letting him know, just, give me grace because I'm doing my best. And I think that if you were to ask him now, I think he'll let you know that I'm doing okay. We're like this. We're best friends. Um, so sometimes it can become overwhelming, but I think it's like I mentioned before, I wear it as a badge of honor. It's probably one of the best things that I've ever had the opportunity to do is be an autism mom because I learned so much from him. And I just keep learning. I don't have a choice but to keep learning, and I like it. I enjoy it. So yeah, I think that's what I would want to tell them.
And I think that from the way you talk about him and the way you talk about like the journey from his birth and everything you and like his dad have done, like the decisions you've made to get him into these therapies and get him these treatments and resources, to me it's very obvious that it's coming from a place of true deep love and admiration for your child. And again, that's one of the reasons I wanted to talk to you because like I think so many of us, especially late diagnosed autistic adults, I wasn't diagnosed until less than 4 years ago.
Mm,
Up until 4 years ago, I had no idea I was autistic. And I had a lot of misconceptions about what autism was,
mhm,
um, because they don't teach you correctly in grad school. They teach you the wrong things.
mm,
Um, and I still have a lot of internalized ableism I'm working through.
mm.
And so I think it's really interesting that autistic adults go from not knowing they're autistic and holding a lot of biases and misinformation to realizing they're autistic, unlearning it, and then very quickly passing judgment on people who don't have that level of knowledge.
Yeah,
Um, and it's something I kind of want to like shake people for. I'm like, oh, like you have to recognize that like what you're doing. Like
yeah,
it is very easy to forget where you come from and forget that you were ignorant once and when you're experiencing something. And I get it. A lot of us autistic adults have severe trauma around being autistic. And so I think we see things through a lens of trauma, which stops us from giving grace to autism parents.
Mm.
And again, trust me, there are some autism parents out there who are just really, really just bad people.
Out of
Um,
touch.
but but that has nothing to do with them being an autism parent. That has everything to do with them being a bad parent or a bad person.
Hmm.
Um,
Okay.
and I think unfortunately people conflate the two.
Mhm.
Um, and I don't know. I want to, not that you need my reassurance on this, but I just want to say, like, it is so obvious
Mhm.
how much you love your son and how deeply dedicated you are to not just learning for him, but learning to be a person that neurodivergent people feel safe around,
Yes.
which we are lacking in this world. We don't have a lot of people who understand us who aren't within our community, who aren't impacted by neurodivergence, like personally, like living with it. I mean,
Mhm.
um, and I think so many people aren't willing to learn about it. So from an autistic person, I want to express like my deepest gratitude that
Oh,
you care so much because I mean, I know it's your son, but like you don't have to care. Like that's a choice. That is a choice you make every single day to
yeah.
continue to love your son that fiercely. Yeah, I feel I'm getting choked up thinking about it. Just like love your son that fiercely and take that beyond just the home and just spread out into the community and say like, look, I have these resources, this knowledge, this love. I'm going to branch out. Because that's what people like me and people like your son need.
Yeah.
Yeah.
Thank you for that, Ollie. Thank you so much for that. Thank
Yeah.
you. No, sometimes I do need that reassurance because it's like I don't want to do or say or come off as insensitive any type of way, or I try to be as neurodiversity affirming as much as possible. So I really do appreciate you for saying that.
Yeah. And I mean, like I said, I think we're all learning.
Yeah.
Like not just about neurodivergence. There's so many things I think that because of the access we have to each other now through social media and the internet, all of us are rapidly learning so much. And one of the things I think we forget is extending each other grace.
Yeah.
I really, you used that word earlier. I really like that. Just like the, like asking, like, just please extend me some grace as I learn.
Yeah.
Because we're all out here with our little pockets of like ignorance or learning or what have you. We're all like, you know what I mean? So I think that's the best thing we can do as humans is just extend that grace and compassion to each other.
Yeah.
Yeah. Okay, my last question for you. Is there anything else that you feel like is really important for people to understand about any of the topics we've talked about today, or anything you want to share that I haven't specifically addressed?
I think we addressed a lot. I want to thank you for even just opening up this platform generally because it's a conversation that needs to be had. And I think that I want to encourage other people, whether you're neurodivergent, a caretaker, a parent of a neurodivergent person, or even a community advocate. I think that I want to let everyone know to just be open to having the discussion, because it can become taboo. However, it doesn't have to be. We can make it as comfortable, as we like. And I think it's important for us to just even tap into it and acknowledge it just as much as we acknowledge, or started to acknowledge the LGBT plus community, um, and make or at least trying to make it safe and comfortable for the community as much as we can. So I think just tapping into it, having the conversation, and being okay with speaking about it, would be my advice for the day. Just, open up a little bit.
Yeah, no, I think that's great. And I think it's so many of us spend so much time really hyper focused on our own pain, which I understand why. Like it's a human thing to do, that
Yeah.
we do forget to kind of take a step back and maintain openness to
Yeah.
learning. Um, yeah. So yeah, I just so appreciate you for being here today and just everything that you do. Not just for your son, but as a person. I love working with you. So there's that as well. Um,
Same, Ollie, same. I love working with you too.
yeah, I think
I think we bounce off of each other. I think that we offer each other different, insight and things like that. But I think since the beginning, it's like, oh, she's a wealth of knowledge. Like I can learn from her, and I appreciate you for that. So
yeah.
yeah, the feeling's mutual, Ollie.
No, I appreciate it. That's how I've always felt about you. I'm pretty sure at our first team retreat, I really going around saying like things to each other, and I was like, Iesha, you've said so much that has just like opened my mind and really like made me think. And like anytime I talk to you, it just like re-amplifies my passion for what I'm doing. Um,
Let me get out of here, Ollie. You're gonna make me so
so right.
emotional.
Oh my gosh. But yeah, so thank you again for everything. I really appreciate it.
Of course, of course.
Yeah.